Good evening and welcome to a final edition of Inside Government for the spring 2024 semester here at Cayuga Community College. This is a show that is put on Spectrum, Verizon Fios, as well as ARMA, the Auburn Regional Media Access, and the college's radio station, WIN 89.1. I'm your host, Guy Cosentino. Before talking about our current show, we do want to give you an update because we had thought we were going to bring you one other show tonight. We did want to let you know that Rachel May, the senator for the 48th Senate District, had to cancel on us, or canceled on us, because she is at the most, I believe right now as we're taping, with the President of the United States and a number of other state dignitaries who are there for the Micron decision and award. So, but we are delighted to have in our studio a discussion that we've had on occasion, most like about every year and a half, 2 years. We've had somebody come in to talk about the issue of the epidemic of opioids and heroin, and we're delighted to have back in the studio the project director of the Healing Cayuga program, Monika Salvage, who has been writing about this but also working in this area. We know that it is an issue in Cayuga County, it is an issue in New York State, it's an issue nationally. But Cayuga County has made some progress in this area. So, A, congratulations on that.
Thank
B,
you.
welcome to the studio, and let's just talk about what you're working on.
Sure,
So,
nice to be here.
For those who may not know what Healing Cayuga is, because when we've had you on, you were here with the Healing Project.
Right.
We'll get to that in a second, but what's Healing Cayuga?
Healing Cayuga is basically a countywide effort to respond to the overdose situation in Cayuga County. That's like the broadest view. It started with a focus on opioids and heroin, and since then has evolved to other substances that we're seeing in the community, and we didn't want to have.
So it's a much broader.
Yes.
So
yes.
when you originally the healing process was funded for up until 2003?
2023.
2023.
Yeah.
So that just dealt with that narrower area. So is this something that what you're working on now, is that now solely funded by the county?
It is not.
Okay.
So I was able to secure another federal grant through the Bureau of Justice Assistance, and that focuses still on substance use, and opioids are still part of that, but it's more expanded to stimulants and to other substances, because that's sort of the trend that we're seeing in general. And this particular grant focuses more on justice-involved people, so people who are getting involved, with law enforcement or at the courts, or also at child welfare.
So before I get to the question on something you just said, you are funded for how long?
Through 2025.
And is that renewable?
I don't know.
Okay. How large a staff do you have?
Well, it's me for the county, and then I'm contracting with an epidemiologist that we had before through the Healing Community Study, who's doing our data analysis, and I also have a contractor who's doing our Narcan distribution, and a contractor who's doing training with our partner agencies. So that's our small team, and then the rest of the funding is going out to the agencies to do programming.
And you're located on North Street?
Yeah,
next to the hospital.
At the mental health clinic.
So you mentioned stimulants. Define that for viewers who may not know what a stimulant, what you're talking about specifically.
So stimulants that could be prescription medications that have that, when you talk about opioids or heroin, it has that, depressant effect. And stimulants are more like something like cocaine. Now what we're seeing a lot is synthetic stimulants. So it's basically made in the lab, oftentimes mixed with different things, and it has that effect of that, that push effect.
Are they deemed as illegal because you say they're in a lab? So I know one of the processes for law enforcement, I know that's not your area, has been they change the formula so often that by the time the government catches up,
yeah,
they've moved on to the next item.
It's such a mixture of things now that sometimes even hard to determine what is in the substance. Oftentimes then also fentanyl is laced into it, which is a synthetic opioid, which makes it even more lethal. And so you have that combination of effects that the different substances have, and so people might go into psychosis, and people might think they have, somebody's after them. And
Would Adderall fall into any of those categories?
I would think so, even though we are more talking about the illicit, the illicit substances that are in the stimulant category.
Okay, you mentioned fentanyl.
Methamphetamines,
right.
those.
So
those
you mentioned fentanyl, and there's obviously a large discussion about what's coming over the border from Mexico, what's coming in from China. Still a problem in upstate New York, fentanyl?
Yes. Yes.
And I know you have been lucky enough that I'm assuming so we have March numbers, and we'll go through those in a little bit, but in March you had 12 overdoses. Any of those involve fentanyl, or do you not know? So
the difference is when we have overdoses that are reported that are non-fatal, we get suspected substances. So when somebody, law enforcement is at the scene and what they're basically suspecting based on paraphernalia or what somebody tells them. The only way we know for sure what's in a substance is when somebody passes away and the medical examiner is doing a toxicology report. Okay. So the suspected overdoses, that is basically what's suspected. And so oftentimes it's unknown because they just don't know what's there. Prescription drugs are often, or over-the-counter drugs is often there. And so what we see, like the trend that we're seeing, it's not the heroin anymore, it's not the types of opioids, it's more those stimulants, it's more usually laced with fentanyl, although we're not testing for that, and then prescription drugs as well.
Fentanyl is again, I'm doing this as uninformed as I can be. Fentanyl is in there because it gives a different, don't want to use the wrong word, but I guess kick compared to, why is fentanyl added in now?
So fentanyl is a filler, and it's really cheap to make because it's made in the lab. And it's really, doesn't take much, like a couple grains of salt is a lethal dose. So you don't need to add much, and it makes the drug way more potent.
Which a user wants.
Yeah, even though they typically don't want to die from it, but it has a different effect, and it's also makes it more addictive.
Would you correlate that someone who takes heroin that has fentanyl in it is likely to die from that dose?
They're more likely to die.
Okay.
Because it's like 100 times more potent than heroin. Okay. So somebody might think they're taking heroin, or even it's mixed into other things. Somebody might think they're taking cocaine, and they know what they can take about, that they can sustain without dying from it, and then there's fentanyl laced into it, and oftentimes they don't know.
So you are most likely the first person who's come on the show in about a year and a half who's mentioned cocaine. So is cocaine making a comeback, or did we not pay attention to it because we were so focused on opioids and heroin?
We're definitely seeing cocaine in fatalities. Again, polysubstance, meaning that people who die from substances, usually multiple substances are involved. But we have seen about I think like 15% or something like that, we have cocaine involved in fatalities over the last few years. So we do pay attention to that, especially because we haven't seen it before. It was all opioids. The focus was definitely on that. But the problem with cocaine and then fentanyl mixed into it is now that usually people who take cocaine, which is a stimulant, they might not have Narcan at hand, which could save them. Right, because Narcan is just for opioids. It doesn't help on cocaine itself. But if the cocaine contains fentanyl, which is an opioid, the Narcan would help. And so the messaging has to change that even people who take cocaine should be prepared that there is fentanyl in it and have Narcan at hand.
Before we get to some numbers, we're going to put up a chart in just a moment. How did you get involved in this?
Prior to this, I was doing countywide projects for Cayuga County. And when we were selected to participate in that Healing Communities grant, my former community service director asked me if...
This was Ray Bazzari.
Ray Bazzari, if I wanted to save lives for a living. And I'm like, well, you can't...
Tough question to answer there.
Right. And at that time, I didn't know even what opioids were. This is not my background. I'm not a counselor.
Well, that's what I was thinking,
Yeah.
because I know you did projects for the county and you worked
Yeah.
at Genesee Street, so
Yeah.
I was wondering how you transferred over.
And that was the reason, because he was looking for somebody who's doing the project management, who can bring different agencies and different partners together and coordinate that effort. And everything that I needed to know about opioids and substance use, I did a lot of learning on my own, and talking to people who know about that stuff, and educating myself along the way. But this is not my background, but my background is in project management and communications and
Well, and
those
we'll
things.
get to a little bit about success. You wrote a nice piece in the Citizen 2 days ago. We'll talk about that in a second. But I know they're going to pop up a chart at some point. So the good news, because the last time you were on, there was no good news. I'm sorry. You were not that you were a downer guest, but you did not have a lot of good news at that point. Your numbers, not your numbers, but the numbers for the county for overdoses are declining, correct?
That is correct.
How so?
I believe, and we just had the discussion today at the Community Services Board, I believe because we were able to start a cross-sector initiative and collaboration just before the pandemic happened through the Healing Community Study, which allowed us to stay focused on opioids during the pandemic, that we were able to put processes and interventions and things that we thought would help in our community into place with all our partners, and we saw that through even past healing.
So is there the decline in rate, is that also being seen in similar size like counties to us?
Not that I'm aware of.
Okay.
I mean,
so why are we different than a neighboring county? Not neighbor, but a like-sized county.
I believe because during the pandemic, we still focused on opioids, and we took that urgency that we saw, because like 1 month after the shutdown, we already had as many overdose fatalities as the whole of last year, the year before.
Right.
So that put us into gear and saying we need to do something now, and we had that team in place that could keep everybody focused, and we had data that we could analyze now and take a look at and make decisions based on, and we brought all the people together and had some tough conversations, because we didn't want to do business as usual, and so we expanded our Narcan distribution, which is the only thing in the immediate that really can save lives from dying.
I want to get to Narcan in a few minutes, but I want to ask this question about this. I will literally say it's a dive in numbers, because I went back to my old questions for you, because I don't want to ask the same questions. But I also usually put a parentheses by a number if I have a number, and the numbers were much, much higher. So looking at March's numbers right now, people can go to your website at the county pages, and there's a dashboard there, which is very interesting and very cool. How you've put data out there that people can easily click on. So March, last full month that we were dealing with, you had 12 suspected overdoses and 0 fatalities.
Correct.
Now, 41% of those involved Narcan. First of all, how do you know that?
So law enforcement reports into that national system whenever an overdose is being reported. And so one of the things that's on that form that are being asked is Narcan being administered, and who's the first entity to administer Narcan at the scene?
So do we know of those 41% that it was law enforcement or somebody else?
Yes, we do.
Okay, who's more?
Well, for that particular month, I don't look at it per month. We look at it over time.
In a trend, is it more often law enforcement, or is it people hanging out with?
Well, prior to when we started the Narcan distribution, you almost always had to rely on law enforcement
or
to come
emergency
and give
services.
Right.
Okay.
First responders in general. Now we have more overdose witnesses administering the first Narcan than first responders, and that's huge.
And so this was an interesting number for me, is that of those, I'm assuming that's based on the 12 from last month in March of 2024, only 17% roughly were opioids.
That we know, yep.
So what's the other 83?
Like I said, prescription drugs, synthetics. Sometimes it's unknown, but we see a lot of prescription drugs that sometimes are taken on purpose, too much, or sometimes by accident.
So when you've been on before, and we've had other people, the sheriff, the police chief, we've talked about, this goes back as far as Ray Bazzari, having conversation. He's been gone, what, 3 years? Roughly? Two? There was always two issues that were a concern. Physicians who are over-prescribing pain medicines. Has that kind of been reined in?
I believe so, because now with the prescription monitoring program, that has really helped if somebody, tried to go pill shopping, from one prescriber to another. Now the prescribers have access to that and they can see if somebody had a script already somewhere else. And so I think that really has come down and is not
And do they prosecute physicians who overprescribe?
That's a DEA
Okay.
issue, yeah.
So the second item was that I go to my dentist, I have a tooth pulled, I get hydrocortisone or something. They prescribe something, I don't use the whole bottle. It sits in a cabinet or a bureau, and I'm not smart enough to bring it to the sheriff's office or a drop box. We have those still
Yep,
around.
we do.
Do we still have people not getting rid of their drugs when, and I'm picking on an oral surgeon. I love my oral surgeon. He's a great guy, but they do prescribe because you're going to have pain sometimes, and sometimes you don't, and sometimes the pill's just Oxycontin. Somebody has a knee replaced, or they have a sports injury. Is that still a problem?
I believe the CDC has put different guidelines in place for prescribers, especially after injuries or after surgeries like that, that deal with the length of how long those prescriptions should last. So I think the gold standard is less than 7 days, and in best case scenario, like not more than 3 days. So that has been put into place, as a guidance, as a recommendation. I still think it's really important to deal with the medications that you have at home on a regular basis. If you have kids at home, definitely have them locked up. And if you don't need them anymore, if they're expired, make sure that they are properly disposed and put them in the garbage.
But you can go, for example, to County House Road. There's a drop box there.
Yeah.
Are there other drop boxes?
Yes, I think we have 12 in the county. So again, on our website, under
Is there anything in the
under
city?
medication disposal.
So where in the city?
At the police department.
Okay. And they're not filmed, that you just dropping it off and it's being correctly. But one thing we don't want them to do, has nothing to do with your department, do not flush them down
No.
a toilet.
We don't want them in the
a sink.
water.
We do not need them in the water supply. We should say that. You need to get rid of them, but you need to get rid of them correctly.
Yes.
So one of the other dashboards, and I thought I brought the chart down, but I did not, was how is it when you have of the overdoses, and it doesn't necessarily have to be in the last month, of the overdoses you have, is it pretty equally, it looked like on the pie chart, pretty equally distributed by age?
No. So the biggest age group that we see is between 25 and 34. So that there's also an increasing. We see some increases in the older population.
Any reason why?
Like 50 and plus. Well, that's something that we're looking at, because it can have something to do with prescription medications that are at home and that might have been taken by accident, or too many of them by accident. So that's something to look at. But in theory, it's not in theory. What we're seeing in general is that younger adult population that is affected.
How about that age group, let's say from 12 to 21? Still a big grouping in there, or no?
No. What we see.
Or are they becoming more educated?
What we see there is more prescription drug misuse, or over the counter.
Okay. Over the counter?
Or over the counter medications. And I'm not entirely sure if those prescription medications were prescribed to them,
Okay.
or if they were in the house.
So
That's a different issue. That's not an substance use disorder issue. That's more, I think, could be a mental health issue.
So I want to go back to the statewide comparison between communities. In your article, you mentioned that a number of elected officials have been asking Kathy Hochul, the governor, to declare a state of emergency. First of all, what does that mean?
So during the COVID emergency, during that pandemic, there was a state of emergency for like 3-4 months, something like that. And there were some changes made in terms of how certain medications, especially when they're controlled substances, how they can be dispensed and how they can be, prescribed, and telehealth, like those kind of things.
Does it divert funds if you? Does it divert or provide additional funds if you do a state of the emergency?
I'm not sure. I don't know what they're really getting at in terms of what they would like to see besides those changes, that have happened during the pandemic.
And right now there is not one, so.
There is not.
Do you think there should be one?
Yes.
Okay.
Yes.
All right. The other.
Because we can't forget that when we had the COVID pandemic, we already had an opioid pandemic or a substance use pandemic, right? Now it might not be opioid that much anymore, but people are moving on to other substances. So the behavior is still the same, it's just the substance has changed.
So anybody who's been involved in local government knows that sometimes there's something, a 4-letter word that's awful bad. It's called turf. You took a different perspective in your article. You talked about how Cayuga County, at multiple levels, multiple government, not-for-profits, are working together, correct?
Yes.
How so?
Because we want to and we need to, and I'm still really amazed how we made this work, that we had people from all different sectors who sometimes have competing interests and competing opinions still come together when it came to how can we keep people from dying. And there was obviously a big push during the pandemic when things got ugly really quickly. But I think no agency can do it by itself.
So give us an example
the county
of somebody
can't do it by
where
itself.
It's changed from 2019 to today. Something you see good that, for example, this is a perfect example of coordination.
For instance, when a lot of the programming that we do, and also agencies, is funded by grants, right? So in theory, every agency can write their own grants and then get their own money and then do what they need to do to fulfill whatever the funder wants them to do. And so we have a very separate system then of, every agency for themselves.
For a cut.
Right, and compete. And we did not want that to happen, so we went about it in a different way. I have some grant writing experience in the project management, obviously, and so I went about, and I'm looking for grants for the county, not necessarily to bring them to mental health, but for the county, so we can support those cross-sector initiatives. And then I work with the agencies.
And so does that mean that you pick an agency and say, you're getting the letter of support from the county legislature or the county, or do you not go to that depth?
No.
Okay.
I'm working with the agencies to say, hey, there is this opportunity out there. I think that would be a good opportunity to have that here, and then how can we make this work? And because oftentimes the agencies don't have either the expertise or the time to go after those grants, because it takes a long time to fulfill all those applications.
So what could Cayuga County still do better in the coordination area? Because there's always room for improvement.
Of course. I think communication among agencies can still be improved, and I think sometimes it's the accountability, right? That we really got to be honest about when something doesn't work so well, and trying to figure out how can we adjust or how can we swivel, and that's why we meet a lot.
Okay. We only have a couple minutes left, so I want to ask you one item that you brought up is this difference between Auburn numbers and rural numbers. First of all, what's the issue?
So what we found, again, from the overdose data that we are collecting is that if somebody overdoses outside the city of Auburn, they were twice as likely to die from it. That was like in the beginning,
Because they're
2020.
away from resources.
They are away from resources. It might take longer for first responders to arrive when 911 is called.
So what have you done to change that?
So again, through the new grant that we have received, the focus was in rural areas. So we expanded our Narcan distribution and stigma reduction campaign in all the rural towns and villages throughout the county. And so now, a year and a half later, the data that we see or that we get is showing that we've tripled our Narcan distribution just in rural areas. And now people who are using Narcan in rural areas, that number has doubled. And the fatality rate has been cut in half.
And you can go to the dashboard and see the charts on that. I have a
Yep.
copy of a map here we're not going to put up, but still 2/3 of it is in the city of Auburn. But it's still nobody should just say this is an Auburn issue.
It's not a city issue alone.
One of the items that you talked about in the past, and I just want to ask because it improved, was the access to treatment. So when you came on several times ago, maybe the last couple of times, you've talked about treatment has not been easily available. Correct on that? And has
That
it
was
gotten
correct,
bad? Does it get better?
I believe it's getting better because, again, we are working with different agencies who, like say peers, for instance. We have peers and also, at the hospital and at CPS and in different entities where they touch the system. And then they help them with referrals to treatment. So it's not up to the person alone
So somewhat
anymore.
it's been streamlined.
Yes.
Okay. I want to ask you a question about your agency as we finish up here, because believe it or not, we've been almost 30 minutes here. Is what Cayuga County is doing a possible model for the state of New York, other communities?
I would think so, and that was always the goal, I think, of the Healing Community Study, to figure out what works and how can we replicate that in other communities. I go on presentations a lot, or I've been asked to, to talk about the work that we do here a lot for state agencies, but also for other communities. And I think we want to share.
So it can be a
what we're
national
doing.
model as well for like-sized communities.
It could be, but it always depends on the people,
Okay.
right?
So I want to thank you again. We've gone through a lot. We didn't even get into what Narcan and other things,
yeah.
And we'll have you back on because there's lots to talk about. But our guest has been Monika Salvage, the project director of Healing Cayuga. I want to thank you for the last half hour talking about the decline in deaths, which is a good news. Still too high. That is your mantra, but progress is being made, and we do encourage people to go to the Cayuga County website to look at the dashboard, look at the numbers, and also make sure that people seek help. More importantly, if you do have things in your bathroom cabinet or in a bureau, you need to get rid of it. Don't dump it down the toilet. Don't drop it in the sink. Go to the sites. We mentioned just the Cayuga County Sheriff's Department and the Auburn Police Department. Get rid of those as well. We're going to be taking a break for about a week now. We'll be back hopefully with a Auburn Enlarged School District Forum, which we've got scheduled for May 7th. Robert Harding of the Citizen will be doing the questioning. I'll do the moderating. So we'd love to have you join us for that on May 7th. Before we go, we do want to do a quick shout out to Nate Hand, one of our students, has been given the SUNY Chancellor's Award. Well deserved, and congratulations on that. If you'd like to send us your ideas for future shows or guests, you can send them to cozguytho@aol.com. I'm Guy Cosentino for Cayuga Community College. We want to thank you for watching, and we look forward to seeing you with the Auburn Enlarged School District Forum on May 7th. So I didn't get to